Hi, I'm Sarah Kinsinger. I'm a health psychologist at Loyola Medicine, and I specialize in treating patients with gastrointestinal disorders and chronic illness and offer a behavioral treatment approach to chronic disease. I appreciate the opportunity to participate in this webinar series. And today I'm going to be discussing how to cope effectively with chronic liver disease and offer some strategies to improve mental well-being. So in this webinar, my goals are to explain the impact that chronic liver disease has on health-related quality of life and the associated psychological concerns that are common among patients. And then I'll describe some coping strategies that we found to be beneficial for patients dealing with chronic illness and some tips on accessing psychological resources in the community. So when we think about the psychological aspects of health and chronic illness, it's helpful to view this from what we call a biopsychosocial framework or model of health. And currently, this is really the most widely accepted model of health and disease. And it's important because it takes into account not only the disease itself and the biological components, but also the psychological, social, and environmental factors. And so this model really speaks to how we need to consider the psychological well-being of patients when we're thinking about health and disease. And in line with this model, physicians and researchers have really become more focused on improving patients' quality of life. And so quality of life is when we focus on the patient's perspective and take into account the physical, mental, emotional, and social domains of functioning. And so when we're thinking about treating patients, it's not just about the health of your liver or kind of what your lab values are showing. We really want to make sure that you as a person are functioning the best you can. And so, how are you functioning at work and your ability to socialize and have a full life? And so as providers, that's really what our priority is. And we want to figure out how to address, all domains of functioning to improve patients' quality of life. So when we think about quality of life related to having a chronic disease like liver disease, what the research shows us is that patients with a chronic illness like this do tend to have more impaired quality of life compared to the general public, but similar to patients with other diseases like diabetes. And so when we think about, all of the factors that contribute to quality of life, there's a wide range of issues here. So certainly the severity of your disease matters. So, as if your liver disease does progress, that's going to make it more challenging to have an optimal quality of life. But in addition to the disease severity, there's a lot of other factors. So certainly symptoms of the disease or symptoms of treatments you're receiving that can affect pain, fatigue, appetite, those are all important. And then psychological factors are important as well. And so depression has been shown to be an important predictor of quality of life. There was even one study that found that in patients with hepatitis C, depression was a stronger predictor of quality of life than even the extent of the disease. And so this speaks to why it's so important to consider psychological well-being and to offer appropriate care for psychological concerns for patients. And so today I'm going to be focusing on what the psychosocial concerns are that are most common among patients with chronic illness and liver disease. There's a wide range of concerns that we hear from patients. And one of the most common ones is impaired sleep. And this can, affect our overall sense of well-being when we're not sleeping well. And it's not clear what the exact mechanism is by which the disease is contributing to sleep impairment. But, nearly 2/3 of patients are having disrupted sleep, either difficulty falling asleep at the beginning of the night or waking up frequently during the night, and then a lot of daytime sleepiness. Some research indicates that the liver disease itself is impacting sleep patterns. And then also, the stress of the illness and depression can also impact our sleep habits. And then in addition to sleep disruption, fatigue is also a major concern for patients. So, almost 2/3 of patients describe fatigue as a problem. And for some patients, they say this is really their most bothersome symptom. So just feeling tired and not able to engage in the activities you want to because of the significant fatigue. And what's interesting is when we look at fatigue related to chronic illness, there's been some research saying that fatigue isn't always, directly related to the extent of the disease, and that in fact some psychological factors are a more important predictor of fatigue than the disease itself. So again, just another indicator that we really want to focus on psychological well-being and optimize patients' mental health. So additional psychosocial factors include, common negative emotions. So, we would expect that anyone having a chronic illness is going to struggle with negative emotions at times. So you're going to feel frustrated or irritable or really down for a day or two. And that's all very normal and it's to be expected. The key is really the duration of those negative emotions. For most of us, those negative emotions are transient, so meaning they only last for an afternoon, a day or two here and there. When they become more long-lasting is when we get concerned about a more significant psychological disorder. We also see a lot of worry. So having a chronic illness brings a lot of uncertainty, right? So we don't know the exact, course of your illness or how it's going to impact your life in the future. So it's common for patients to worry about, the impact on their family, your career, your ability to work, whether you're going to need a transplant one day. And having these concerns and worries, again, is very normal. It's to be expected. But it's when these worries really become more persistent and severe that we are concerned for a more significant mood disorder like clinical depression or anxiety. So again, the key here is the duration. So when negative mood states and worry becomes more persistent, it's happening nearly every day. And then also when it begins to interfere with your functioning, so your ability to interact socially or work, that's when we're concerned with this turning into a more significant mood disorder. And we do know that patients with any type of chronic illness are at higher risk for psychological disorders, particularly depression. And studies have shown that this is true for patients with liver disease as well. One study found that more than half of patients with liver disease were reporting significant depressed mood. And when we look at actual rates of what we characterize as clinical depression, nearly a third of patients with liver disease met criteria for clinical depression. And the rates were pretty comparable between hepatitis C or fatty liver disease. And it's really a complex relationship between depression and liver health that we don't fully understand yet, but it does seem to be somewhat of a kind of bidirectional relationship and can turn into sort of a vicious cycle for patients. Because we know that, the liver disease itself can increase your risk for depression, in part because we think that aspects of the liver disease can influence neurotransmitter pathways that make people more susceptible to depression. And then, of course, we know the stress and stigma of living with a disease like this can negatively impact your mood. So, thinking about the disease putting you at risk for depression. But then what happens when we're depressed? Well, when we're depressed and our mood is low, we tend to isolate. We don't always take the best care of ourselves. And sometimes we turn to, poor health behaviors. So maybe we start drinking or smoking or have poor eating habits. And all of those health behaviors can negatively impact the health of our liver. And so we then experience worsening disease, which then makes us at higher risk for depression. And so you can see how this turns into very much a vicious cycle. And we want to be able to intervene in that. And one of the ways we can do that is by effectively treating depression. So again, speaking to this kind of bidirectional effect of depression and disease, in addition to the disease itself putting you at higher risk for depression, we also know that depression can negatively impact the disease, so in part due to the poor health behaviors that I spoke about. But then also we think there's something about depressed mood and physiological stress that can contribute to systemic inflammation and maybe worsen the health of your liver. So again, that's why we want to provide effective treatment. And to highlight really this connection, there was even a study in 2015 that found an association between levels of anxiety and depression and an increased risk of mortality from liver disease. So this is, it was only an association, and we can't really draw conclusions from this, but I think it again speaks to how there really is a strong link between psychological health and physical health and the importance of addressing patients' mental health needs. So in order to do this, we need to be able to recognize clinical depression. And so when professionals diagnose clinical depression, these are the criteria we are using. So you have to meet criteria from one of the first two bullet points here. So feeling down, depressed, sad, empty, or hopeless for most of the day, nearly every day for the past 2 weeks, or having a loss of interest or no longer finding pleasure in things that you used to enjoy. So either of those would indicate the presence of clinical depression. And then in addition, patients often report maybe changes in weight and appetite, changes in sleep habits, feeling agitated or keyed up, fatigue, having a loss of energy, feelings of worthlessness, difficulty focusing or making decisions, and thoughts of harming oneself. And you can see some of those symptoms overlap with symptoms of chronic illness. And so this is why it's important to talk to a professional so you can sort out, what components of this are related to your disease, what's related to maybe a separate mood disorder, and how to best address it. And the key is really to catch this early, again, to prevent that vicious cycle that I touched on. We want to provide treatment and resources at the early signs of depression. And so kind of knowing what your red flags are is important. And if you've ever struggled with depressed mood before, you may know what some of those red flags are. So some people say they're more likely to isolate themselves, or they get more irritable, kind of have a short fuse, or maybe their behaviors change. They start drinking again or emotional eating. So knowing what to look for is important. And maybe also having a loved one who sort of knows your red flags and can have an eye out for them is helpful. So I'll be discussing coping strategies and tips for improving negative mood states. But if you do meet criteria for clinical depression, as I've outlined here, it really is very important that you're set up with a professional to help you work through this and treat it. So let your doctor know what's going on, and they can set you up with a psychiatrist or psychologist to, get you more individualized treatment. So I'll be shifting gears now to focus on psychological strategies and interventions that we use with patients with chronic illness. And I want to emphasize that, as a health psychologist, really the work that I do is it's in part focused on treating anxiety and depression that can occur with a disease like liver disease, but we're also working with patients on really maximizing your functioning with this chronic illness. And so it's not just about treating the psychological comorbidities, but it's about how do we help you kind of optimize your coping, your functioning, and be as resilient as possible, even living with this, this challenging illness. So most of the coping strategies I'll be covering today fall within a cognitive behavioral therapy framework, or CBT framework. And so this is a style of therapy that's been used quite a bit for various psychological conditions like depression and anxiety, but also with many medical populations. It tends to be more short-term and more of a skills-based treatment approach. So you're working collaboratively with the therapist to learn coping skills and strategies. And it really focuses more on the current problems you're dealing with rather than past traumas or concerns. So here's a list of the specific strategies we'll be touching on today. starting with this idea of acceptance. So this is really a theme that sort of runs throughout all of the treatment strategies I use with patients with chronic illness. And so when we think of acceptance, this is not simply, resigning oneself to a life of disease. It's more about, how do we willingly face the challenges that are in front of us and be proactive about managing our health. There's been some research that has shown that in patients with inflammatory bowel disease, the degree to which a patient accepts and adjusts to the changing demands of the disease, they're going to have higher quality of life. And so, we don't want patients to be in denial to avoid the illness because that only seems to amplify stress and symptoms. And so, what we work on is, really acknowledging and accepting the changes in your disease status. And so, if you realize there's a progression in your disease or you're having symptoms that are making it difficult to work, acknowledging that and adjusting your activity level in your life according to what's happening with your health. And when we see patients, willingly kind of making these changes and adjustments, based on their health status, we see them coping much better, and so that's really what we're encouraging is that acceptance approach and how to be proactive. And so we do find that in terms of a barrier to acceptance, when there's a lot of rumination, a lot of negative thinking related to your illness, and patients get stuck on why did this happen to me? How could this have happened? What does the future hold? What if I'm not going to be able to work? What about my career? These negative worries and this negative mindset makes it difficult to accept and move on in a healthy way. And so we encourage patients that instead of ruminating about the past and worrying about what you can't control, we want to focus on what can you do positively to impact your health. So you can be taking your medications, following your treatment regimen, making sure you're sticking with your doctor's appointments, maintaining a healthy exercise schedule, modifying your diet in the appropriate ways, and focusing on these disease self-management strategies will allow you to cope more effectively. So in addition to acceptance of the disease, thinking about one's support system and network is also a really important aspect of coping with chronic illness. And as this cartoon depicts here, people don't always know you have an illness depending on how your particular disease presents. They may only see you on your good days or when you're feeling well. And so sometimes thinking about your support system involves disclosing your illness and disclosing it in the right way to the right people, but it's often necessary to get the kind of support you need. And we also have to think about, starting with just identifying the different types of support that you can benefit from. So we can sort of break down different types of support into emotional support. So, having someone to talk to, someone to vent to when you're having a bad day, someone, that can kind of hold your hand through these trying times. There's also tangible support. So maybe you need someone who can take you to the doctor's appointments, pick up some groceries for you when you're not feeling well. And then also informational support. So maybe you need to connect with other patients who have a similar disease or are going through similar treatments. Or maybe you need a loved one to go to a doctor's appointment with you and understand your treatment options and be able to sort through those with you. But the first step is really identifying, okay, where are there any gaps here? And if there are gaps, who can I reach out to fill those? And then recognizing that you may need to teach your support system about what you need. Again, people don't always know you're sick, and people don't always know the ways that you're struggling unless we tell them. We're not mind readers, and so learning to be assertive about your needs and ask for the support from other people is an important skill in managing a chronic illness. So next I'll be focusing on this idea of behavioral activation. So this is a treatment strategy that's one of the key components of our treatment approach for clinical depression. and it's one of the most effective strategies for fighting off depression. So behavioral activation involves proactively scheduling activities that bring pleasure or a sense of accomplishment. And this helps to fight off negative mood states and encourage positive mood. Because what we see happening is when we are struggling with persistent depression, we end up isolating more, we withdraw, we're less likely to engage socially and do things we typically enjoy doing. And we also have really just a loss of motivation. And so it's really hard to kind of get ourselves going and want to engage with other people and do things that we used to enjoy. And so behavioral activation means actually scheduling activities. So, again, being proactive about making sure these types of activities are occurring on a daily basis, even if we don't feel like it. So you can start by just making a list. What are things that I used to find pleasure in doing or used to be enjoyable to me? And they could be small things like doing a crossword puzzle, knitting, doing a craft, or bigger goals like finding a volunteer job, signing up for a class, planning a trip. Um, and this may be challenging because of your disease state and your health. There may be things that you used to enjoy doing that physically you're just not able to do anymore. And so you may want to get creative in finding new activities or new strategies, new things you've not tried before. We really want to focus on, what can you do now and build in those positive activities, not focus on what you can't do. And so once you have your list, and then you want to make a point to actually schedule them, just like you would schedule another appointment in your day, schedule these positive activities. Because again, when you are feeling depressed, you're less likely to be motivated to do these things on your own. So when we have things scheduled, like an appointment, we're more likely to follow through with them. And so schedule these positive activities, these things that will bring a sense of accomplishment, every day. And related to scheduling and building in activity into your day and into your week, we have to think about, what you're physically capable of doing and how we need to make adjustments based on your health. And we talk about this in terms of what's called activity pacing. So for exercise and any type of daily activities, this can become more challenging depending on your health. If you are having more pain or fatigue, you may not be able to function the same way you used to. And we see problems when people end up falling to sort of either end of the spectrum here. So some people tend to overdo activity, so they may ignore the fact that they have these physical limitations now and continue to push themselves sort of beyond their limits. And this ends up resulting in feeling exhausted and just crashing, which isn't good. And then the other end of the spectrum is when we avoid activity altogether because of pain or fatigue. And then what happens is we become physically deconditioned. And even when we try to do a little bit of exercise, we become easily fatigued and have pain at even lower levels of activity than we used to. And so that's not what we want either. And so really our goal is this middle ground of pacing ourselves. So recognizing our body's limits, but still pushing yourself to remain active even with having some pain or fatigue. So some tips on pacing our activity involve scheduling activities for a time of day when you know you feel best. So if you know you have the most energy in the mornings, that's the best time to schedule your exercise or some of your outings. And then also recognizing when the fatigue or pain is likely to set in and stopping before you get to that point. Again, we want to avoid getting to a point of exhaustion. Scheduling breaks is also important. Maybe you didn't used to have to do this, but now, breaking things into smaller components and giving yourself an opportunity to rest in between can be important. And then finally, learning to prioritize and say no often is very important. So you may not be able to accomplish the same amount that you used to. And so just tackling the most important activities is okay. And we want you to give yourself credit for that. And then saying no to things that maybe aren't as essential is going to be important for, maintaining your health and well-being. And as I touched on before, a lot of anxiety and worry is common with having a chronic illness. And if you notice that it's getting to a point where it is excessive and it's affecting your mood and your functioning, then you want to have some strategies to combat that. So the thing about worry is that sometimes it's actually helpful and it's good for us. We call this productive worry. Productive worry is when it leads to solving a problem or coming up with a solution. And so some worry is okay, but then there's also unhelpful worry. So unhelpful or unproductive worry is when there's no immediate problem to solve. Maybe you've done everything you can towards the problem, or it's not something you can do anything about. And in those cases, we want to learn to really contain those worries and, try to minimize them. So some strategies for doing this is to really challenge some of these worried thoughts. And I call this, having some thought restructuring or worry control questions. And some examples of these are, asking yourself, am I really overestimating the likelihood that something bad is going to happen? When we feel anxious and stressed, we tend to focus on the worst case scenario, and it feels very likely that that worst case scenario is going to happen, but that's not always the case. And we need to keep in mind that, often there's other potential outcomes that maybe we're not acknowledging. Maybe giving yourself time to worry about the issue, but then containing it, saying, okay, I'm going to have 10 minutes here to worry about this, to ruminate on it, but then I'm going to move on and let it go. Sometimes even journaling for that 10 minutes can be helpful. And then you close the journal, you put it away, and you try not to think about it again. And then sometimes it's helpful to think about how you would be maybe counseling a friend in a similar situation. Often when we're talking to others, we have a more balanced way of thinking about things and more positive than we do with ourselves. And so asking ourselves, what would I be telling my friend in this situation can be helpful. And then also thinking about how you've handled things like this in the past and whether you're minimizing your ability to cope with whatever the situation is. It's easy to get stuck on with worries, kind of the awfulness of what we're concerned is going to happen, and forget that, we're pretty resilient people, and maybe there's been times in the past where you've handled adversity or challenges quite well, and, you've gotten to the other side of it okay. So giving yourself credit for those past accomplishments and that past resiliency can also be helpful. We can also reduce worry and just general stress by using various relaxation techniques. And this is something I use with virtually all of my patients with chronic illness because it's so helpful for both mental and physical well-being. Um, it can have a calming effect mentally, and then also can really help to cope with some of the physical symptoms we experience as well. So pain, nausea, or fatigue, these relaxation strategies can actually sort of turn down the severity on some of those symptoms. And there's a wide range of strategies you can learn or you can use. So progressive muscle relaxation, where you sort of mentally go through each muscle group in the body and you try to reduce physical tension in the body, using guided imagery, diaphragmatic breathing, and even medical hypnotherapy can be beneficial for a lot of patients. One of the simplest exercises I use with patients and simplest ones to implement is what I call diaphragmatic breathing. So this is where you're taking slow, deep breaths from your abdomen. So rather than breathing from your chest, which we do when we're more stressed or anxious, we want to shift to having these slower, deeper breaths. And this actually helps us on a physiological level. So when we breathe like this, it engages what's called the parasympathetic nervous system. And so that turns off the body's fight or flight or stress response. And when we engage that parasympathetic nervous system, we get more oxygen into our bloodstream, more blood flow to our muscles. This helps to lower our blood pressure, slows our heart rate, and reduces overall physical tension. And then in addition to those physiological changes, again, it has a calming effect as well. It can give your mind something to focus on. So rather than worrying about the other things that may be causing you stress, you can take a few moments to just think about your breathing. And this is something that's pretty easy to learn and implement on your own. There's YouTube videos and probably instructions you can find online, and then it's something you can really do anywhere. By taking a few deep breaths, you can get some control over that stress response and learn how to create a sense of calm and relaxation. And if you do want some guidance with breathing techniques or with other guided meditation, there's some really great apps available that are free or very low cost. And so here's some examples of some that other patients have found beneficial. And for a lot of my patients, we have a goal of, let's practice with one of these apps or practice your breathing exercises for 10 minutes a day. And it's amazing how even, a small amount of time like that can really improve a sense of well-being and fight off negative mood. So finally, before I wrap up, I want to touch on, some suggestions for reaching out and finding a professional if you'd like to learn more about these types of strategies, or feel like you could use some professional assistance managing your mood. So here I've got a list of therapists or resources for finding therapists. So on these various websites or organizations, they all have sort of databases with lists of therapists, psychologists, licensed social workers, and so you can search on there for someone in your area, and many of them also you can search for a certain specialist. And so I'd recommend trying to find someone that's listed as a health psychologist, so they're familiar with working with patients with chronic illness, or someone who practices cognitive behavioral therapy, which again is in line with a lot of the strategies I touched on today. And so these would be providers that would provide counseling or psychotherapy, treatment for depression. In addition to finding a therapist with one of these resources, also keep in mind that if you're concerned about clinical depression, you probably want to speak with your physician about the possibility of a medication, or even consult with a psychiatrist, because for some patients that is helpful to use a medication either alone or in addition to psychotherapy to fight off depression. And it doesn't always have to be a long-term commitment. Some patients find they need just a short course of medication to sort of give them a boost, get them on the right track with implementing the appropriate coping mechanisms. And so again, if you think you would benefit from that, reach out to your physician. So some take-home points from today are that we know quality of life is compromised in patients with chronic illness, including patients with chronic liver disease. And so we want to think about what we can do to enhance quality of life. And one of the ways we can do this is by addressing the psychosocial concerns that we know are present and can sometimes be serious and lead to a clinical depression or anxiety disorder. We do have effective treatments for these conditions, and for example, cognitive behavioral therapy is a very effective approach. It can be effective for treating depression, but also enhancing coping skills for managing chronic illness. So again, I'd encourage you to not only think about some of the strategies I discussed today and which could be applicable to you or helpful to integrate into your sort of healthcare regimen, but then also reaching out to a professional therapist if you'd like some more guidance in navigating the struggles of this chronic illness. All right, thank you so much.